Professor Craig Vincent Lambert, Faculty of Health Sciences, Professor Annie Temane, the inductee, Professor Marie Pochenpoel, Professor in Mental Health at the University of Johannesburg, senior leaders of the university, members of Senate and other academics, distinguished guests, students, all who have joined us. Sanibonani, goeienaand, good evening, Tobela. It is a great honor and a special privilege to welcome you to the Professorial Inaugural Lecture of Professor Annie Temane. As I do so, I wish to warmly welcome her loved ones, family, friends, special guests, and colleagues. This is indeed a proud and joyful, yet a landmark moment for all of you, for Professor Temane, for all of us here at UJ, for higher education in South Africa and beyond. During my previous appointment as Executive Dean of the Faculty of Health Sciences, I had the pleasure of working closely with Professor Annie with her appointment of Vice Dean, Research and Innovation. So I can attest, and I have first-hand experience to the value add that she brings as a member of your team. The inauguration of a professor is a public ceremony in which newly appointed professors are inducted into office by the Vice-Chancellor and deliver their inaugural addresses. The ceremony has its roots in medieval university and serves multiple purposes. First, it is an expression of welcome and an entry for new professors joining the circle of colleagues who are already professors. Secondly, it provides a platform for professors to display their expertise in the discipline and showcase their research. In the colonial traditions subscribed to by many universities, assuming the role of professor refers to the gown and the cap. Once we have listened to the inaugural address, the gown, denoting the professorship, will formally be assumed. Today we gather to witness Professor Temane's entry into the illustrious community of scholars at our university. It celebrates her contributions to the discipline and ultimately her impact on society. Professors provide a university with its identity, character, academic legitimacy, and integrity. The inaugural lecture is a rite of passage following the confirmation of the appointment of the person as a professor. This evening, we will listen to Professor Annie Temane as she presents her inaugural lecture. This address is when her expertise is showcased beyond the corridors of the university and reverberates within society. It stands out as a moment of pride for the incumbent, the family, fellow scholars, and the university, and ultimately society. In the past, several philosophers and scholars have defined universities using very narrow conceptualizations. For example, the search for truth, for universal knowledge, and even as instruments serving the purpose of the economy or being very utilitarian in nature. Through our work and research at UJ, I hope that we can break out of these narrow conceptualizations and reflect on the university as contributing to the public good, working towards societal impact. What is then the role of an intellectual? Edward said in one of his articles, defines the role of an intellectual, and I quote as follows: one who commands a vast knowledge of a specific discipline, one who is rigorous in their analysis of literature, who views being an intellectual as a vocation, and who functions as a kind of public memory to recall what is forgotten or ignored, to make the connections that are otherwise hidden, and to provide alternatives for mistaken policies. It remains then for us, as a university with a Pan-African vision, to derive our mandate as intellectuals and as professors. And importantly, how do we embrace the role of a professor as a disruptor while continuing to be a flagship carrier of our disciplines? This evening, we will listen to Professor Annie Temane as one further step in the journey of being a professor. This is a journey which does not conclude once this lecture has been given. Notwithstanding, this inaugural lecture does create an opportunity for self-reflective pause in the journey of a professor. Let me now invite the Vice Dean, Professor Craig Vincent Lambert, to introduce Professor Annie Temane. I thank you, Ria Leboga, Ngiyabonga, baie dankie.
Vice-Chancellor, honored guests, it is my pleasure to introduce Professor Annie Temane. Professor Temane studied her undergraduate degree in nursing at the University of Botswana, now known as the University of Northwest. She completed her basic degree in record time and achieved an Academic Excellence Award for Pharmacology. Her eureka moment, as she puts it, and love for psychiatry was when one of her lecturers gave the class a diagnostic manual to diagnose mental disorders. This was a case study and an activity. She decided right there and then that this was the area that she wanted to specialize in. When her now mentor came to the university for a seminar on psychology, this confirmed her idea that this was the path she needed to walk. And she sought to complete her basic degree and then go on with postgraduate studies. After completing her undergraduate bachelor's, she immediately wanted to start with a master's. However, the selection committee indicated it would be better if she got some experience working in psychiatry. She did not give up on this pursuit, but took the advice of the selection committee and commenced her career path in 1990s at an academic psychiatric hospital in Pretoria as a professional nurse at the Child and Family Unit before moving to the Adolescent Unit. From there, she also worked in a private hospital as a professional nurse and was promoted to senior professional and nursing care facilitator, and dealing with groups of patients mostly diagnosed for post-traumatic syndrome. After 2 years of gaining experience in the workplace, she applied again and was accepted in a master's degree in psychiatric nursing. She completed the master's degree from the Rand Afrikaanse University in 2004, now the University of Johannesburg. Prof. Temane remains a registered advanced psychiatric nurse with the South African Nursing Council. Although in private practice as a consultant, Prof. Temane remained connected with academia and acted as a part-time clinical facilitator for both undergraduate and postgraduate students. This was when her passion for supervision of students emerged. In 2010, she graduated with a PhD in psychiatric nursing from the University of Johannesburg. She also started working permanently at the university as an academic in 2010. Her responsibilities included teaching and learning for undergraduate students and postgraduate supervision, as well as independent research. Prof. Temane's passion lies in postgraduate research supervision, mentoring, and research ethics. She has supervised 10 master's students and 20 doctoral students to completion. Prof. Temane has published many articles in peer-reviewed journals relating to psychiatric nursing and mental health care, and has presented at national and international conferences. Currently, she mentors 8 academics who also aspire to develop and grow their professional specialities. Prof. Temane has served on a number of committees, including the Research Ethics Committee. She has acted as Vice Chairperson and chaired the Higher Degrees Committee at the faculty, and has served as a committee member on the Research Ethics Committee Association of Southern Africa, as well as UNESCO's National Bioethics Committee and the South African Medical Research Council's Bioethics Advisory Committee. She has acted as a consultant for qualitative research at the Steve Biko Bioethics Center at the University of Witwatersrand, and served on the editorial board of Health SA Gesondheid Journal as a section editor. Prof. Temane has also been a reviewer for a number of psychiatric journals, both nationally and internationally. Prof. Temane was nominated to serve on the Ministerial Advisory Committee on Mental Health and the National Health Research Council, where she was a committee member and vice chairperson of the Woodside Sanctuary for the Intellectually Disabled. Prof. Temane has been a panel member and has reviewed a number of research grants for the NRF Fund. Prof. Temane is a representative of the Faculty of Health Sciences at the Universitas 21 grouping. This is a unique grouping of top universities internationally, of which UJ is the only one in Africa. All of the above, I think, just reflects the passion that Prof. Temane has for mental health and research in general. In 2017, Prof. Temane's journey took a managerial and leadership pathway, and she has served as head of the Department of Nursing at UJ from 2017 to 2020, and then as the Vice Dean in the Faculty for Research and Innovation from July 2020 to December 2022, where she has served as our Acting Executive Dean up until today. Professor Temane.
Okay. Good evening. I'm so overwhelmed by this moment. I would like to thank the VC Factionary Professor Siham Khan and the Vice Dean of Faculty of Health Sciences, Prof. Lambert. I'm honored and privileged to be granted this opportunity to share my inaugural presentation. Today, I want to take a moment to express my heartfelt gratitude for the incredible support I received through my academic journey. In psychiatry, we use a lot of metaphors and we use a lot of reflections, and that's what I'm going to do today. If you can see this tree reminds me firstly of my dad. He loved Louis Armstrong, and he used to sing like Louis Armstrong. And the song that he liked, and we love everybody in the house to sing, it's what a wonderful world. And if you can see, the first lyrics of the song is, I see the trees are green. That was one of his favorite songs. And it reminds me also of assessments that we did in advanced psychiatric nursing. The first time that I did attend my first assessment or selection, we were asked to draw a tree. I didn't know how to draw a tree. Now that was a lot of pressure. This achievement is through the acknowledgement of firstly of my departed parents, George Sefokane and Margaret Temane, who made sure that education became an important part of my life, my siblings, their children, grandchildren, great-grandchildren, who are here with me today. I want to thank you, the Temane Morgans. I appreciate you and I love you. For my peers in psychiatric nursing and the nursing discipline, especially in midwifery, I'm grateful for the journey that we took together up to date. For the undergraduate and postgraduate students that I've co-created and co-journeyed with, thank you for the lessons learned. I am because of you. I've been fortunate at every stage of my career life. I must say I'm blessed. I didn't want to say that, but when I thought about it, I must say I'm blessed. As it is in this room, I have 3 bosses. One is an ex-boss and 2 are other bosses. 2 ex-bosses and 1 boss. Yes, I'm correct. So I've been very fortunate, and I must say I'm really, really blessed. I cannot really underestimate that. In my career, to have mentors who have served as my reflection mirrors to help shape my career to date. Thus, with mentoring I've received, it was easy for me to step in and show up for the other academics and mentor them. Some of the mentees are here today. I would like to say I appreciate you and I see myself through you during our sessions. To my friends who are in this room, to my friends who are online, and the academics from near and overseas, thank you for guidance, love and support you have always had for me. I'm thankful for my 2 previous deans in the Faculty of Health Sciences who believed in me and walked the path with me, encouraged me to join the research leadership and UJ Human Leadership programs. These programs enabled me not only to form fruitful academic relationships, but journeys of learning and discovery. I'm grateful for that, and I will never forget that. I am standing on shoulders of giants, of mentors, family friends, personal friends who have supported me through my academic career. Your confidence in me and I appreciate it up until to date, has been amazing, if I can say, and been a great inspiration. I'm grateful to have each of you by my side. Thank you for your kindness, your encouragement, your unwavering support. So I'm going to go into my address and tell you a little bit about mental health, because that's a passion that I have, and it is up until today. Mental health has been part of my career as long as I can remember. As a young nursing student, I knew that this path will open up possibilities in understanding what really mental health is all about. I think on hindsight, to a really honest fact, I didn't want to see myself working in the medical ward. My brother had to help me all the time to study anatomy and physiology and draw things. Unfortunately, he's not here today. I'm grateful for that and for him. I was just curious about why people will make derogatory remarks about a person who's mentally ill. I felt that there was more about mental health other than mental illness. The first time that I met a mental ill person was in clinical practice, and I can hear his sounds when I wrote this paper. I could hear how he screamed in the passage. He was an acute patient. But when I got in that acute ward, I felt happy. I felt I like being here. This reminds me of a quote by Maya Angelou. Open quote, they may forget your name, but they will never forget how you made them feel. That is psychiatric patients for you. You will never underestimate their intelligence. And I'm pleading that you should never underestimate their intelligence. For me, I always thought that there is a fine line between mental health and mental illness. As an academic, I love and still love teaching Introduction to Mental Health. For my students, that was the longest class. For them, it was boring. For me, it was an opportunity to provide them with insight into what is the phenomenon of consent for us as psychiatric nurses. The phenomenon of consent was and still is to promote good mental health and physical health and well-being to prevent mental illness. This is a challenge that we're still facing today. My philosophical stance was to firstly ask myself and the students, this was our entry to our Introduction to Mental Health, and the student these questions to guide me in understanding how to treat patients, individuals, and others. Who am I? What is the meaning of my existence? What does life and death mean to me? What is the origin of illness and mental disorders? And who is God? The World Health Organization statement on mental health clearly advocates for a state of well-being for people to realize their capabilities to cope with daily activities, living and becoming productive and fruitful in order to make a meaningful contribution in their communities. I believe in this quote, open quote, the two are interlinked. Mental health is a priority for SDG number 3, good health and well-being, and the target 3.4 by 2030 indicates that promotion of mental health and well-being needs to be advanced in communities. By creating communities, people can flourish and have that awareness of their connection to their world. I would like to address my title, as you have seen it, through the reflections of my psychiatric nursing journey. In this address, communities for me refer to individuals who participated in the research that was undertaken as I journeyed through the ranks of academia to date. The communities are people living with mental health conditions, caregivers for people living with mental health conditions, and most importantly, the people who care for them, the psychiatric nurses. It's a fact that our country only spends 5% of its total health budget on mental health. I may be wrong, but it's little money. It can also be less. There's a mental health state report of 2021, and there's another one which came out now for 2022. But this one specifically, South Africa was one of the countries where it was included in this mental health report, whereby 34 countries have to be assessed on their well-being or well-being of these countries using the mental health quotient. In South Africa, not only South Africa, there were 3 countries. South Africa was amongst them, and the other one was UK, was one of the countries that scored the lowest on the mental health quotient. Now, if you remember, 2020 was not a good year for us. We struggled with COVID, and COVID made mental health to be more open. People didn't even understand what is mental health. Everybody, it was a buzzword for everybody. But for us, it was something that we had to deal with. So mental health for me to date is a pandemic. This makes me to ponder on the following. Are we as researchers in mental health doing enough for people living with mental health conditions to access mental health services? My argument is that achieving mental health is essential and needs to be non-negotiable. We can't ignore the challenges that come with mental illness and the access not only treatment, but also to human resources. There is a struggle that is going on. I remember one of my friends, when the struggle was finished, and we went to Robben Island, and she said to me, she is in the room, I'm not going to indicate, and she said to me, let's join. I looked at her and I said, what struggle? The mental health is a struggle right now. One is to appreciate the communities that allow us, myself and my students, in their world to understand the world on mental health and mental illness in nursing. And that's why I love mental health and nursing. In psychiatric nursing, there are 4 key points that one has to always explain. You have to explain what is an individual or a person, what is an environment, what is health, and what is nursing. And for me, it's mental health, nursing, and mental health. I have learned to appreciate these components in psychiatric nursing as they provide a frame of reference to view a person holistically in their context and the relationship that shape the way we respond to their world and how they interact. Now, through my research, as I look through my research, there were 3 things that came up with the research that we've done. It was burden of care, it was people living with mental health conditions, and then it was the psychiatric nurses themselves. And that is why I said my focus will be there. So with the reflections, I'll start with the reflections on burden of care. It is not easy for people who are caring for people with living with mental health conditions, because this demands a lot of time and energy and empathy and sometimes compassion. And sometimes these people don't have it because it is too much for them. And this caring for people with chronic mental illness or people living with mental health conditions has a detrimental effect on their caregivers' daily lives and caring for these people. Lack of support caring for people living with mental health, if it's unresolved, it becomes a burden they carry for the rest of their lives. So I want to show you some of the published papers of the burden of care that we and my students and my co-authors that we have looked on the burden of care. Recognizing that this burden of care, it is essential. Sorry that my voice is failing me. This studies highlighted the prevalence of the burden of caregiving. Thank you so much. I apologize for the people online and for the people in the room. These studies highlighted the prevalence of the burden of caregiving and the factors that are associated with caring of people living with mental conditions. They also provided insights into caregiver burden in rural and urban settings. Don't be fooled. Mental health and mental illness is in everybody's houses, and it's everywhere in our communities. The impact of caregiving has been studied globally. It has been established that it is emotionally and physically draining to those who provide care to the people living with mental health conditions. Thus, as said, recognizing and addressing mental health impact on people living with mental health conditions is essential for both the mental well-being of the caregivers and the quality of care they provide for the people living with mental health conditions. Most people, before I come to here, most people do not understand the caregiver's burden because people don't understand what they go through. When it comes to lived experience of people living with mental health conditions, I must say, and I must make this as a joke, I don't know if it's a joke, but every time when we did studies on lived experiences, people will say, but why, researchers will say, but why are you always doing lived experiences? Why is it everybody lived experiences? Fact is, nobody can tell you their story better than the people who has lived through it. And that's a fact, because nobody else will be able to tell you another story. Now, the people living with mental health conditions are the most disadvantaged, vulnerable people in our communities. You just have to look around. When I drive in the morning, I know which months that there's a high number of people on the highway. Then I know which month it is it. Especially in September, when I drive up to work, I see more people on the highway who are not well. You know, sometimes I feel if the highway was not fast, if I can just stop and say, "Are you okay?" They seem to be living in their own world, and that is the most hurtful thing that you can ever see. From any practice or years of practice as a psychiatric nurse, I've learned that people with mental health condition are also human beings. And those who have, and there are psychiatric nurses in this room, those who have worked with people with mental health conditions, and if you did not understand them, they will make you to understand them, and you will learn how to work with them. They also have rights. They also deserve the same rights and freedom as every human being, regardless of their mental health status. People with mental health condition provided insight when we did research how they experience their mental health condition and challenges. Having worked both in public and private sector as a psychiatric professional nurse, I can affirm that no one can tell a better story about mental health conditions than the people who are living with it. Following the research that was conducted by the student and myself, understanding the perspective of living with mental health, these are some of the papers that we have. Just some, and there's still more to come. People with mental health conditions provided different views on how they live and they cope daily with their conditions. My argument is that in order to understand and achieve mental health for our communities, it is necessary to continue to study the subjective experiences and personal perspectives in order to understand their lived experiences for the people who are recovering and coping from mental health conditions. Now, I come to the most important people in mental health, the psychiatric nurses. Psychiatric nursing, people can argue that it's not a specialty. It's a science. It is a specialty that requires dedication, commitment, passion, and compassion in time for caring for people living with mental health conditions. Psychiatric nurses are not limited only to basic nursing care. The most important thing that I've become aware as I went through this journey of academia is that more nurses wanted their voice to be heard in advocating for people living with mental health conditions. I would like to take you back in 2016, when the healthcare fraternity experienced an unfortunate tragedy which could have been prevented, where 144 psychiatric patients died and their human rights were violated. And this had a negative impact. This had a negative impact to the nursing psychiatry to date. There was an inquest, and I know people have read that the people who were in high positions were really blamed for those death of those patients. It is said that people who are in high positions can forget that these people that they're dealing with are psychiatric patients. The voices of psychiatric nurses were very silent in this matter, in which was also said, for us and my co-supervisors, and we will ask, what are you doing about it? What is there to do about it? Fortunately, we find 2 students who were passionate about this, and we published 2 papers in experiences of psychiatric nurses and advocating for mental health, and the one that is now at the top is the experiences after the closure of life as Temane psychiatric care centers. These results highlighted the frustration and helplessness they have experienced in trying to promote human rights of the people with mental conditions. Lessons learned. Psychiatric nurses play a crucial role in caring for people living with mental health conditions and those without mental illness. Their voices matter for caring for people living with mental health conditions. The World Health Organization says, and it is, you can see it, there are not enough general and specialized health professionals in low and middle income countries who are working with mental health issues. And South Africa is one of them. In South Africa, as Jack et al. Quotes, the percentage of psychiatric nurses caring for people living with mental health conditions is only but 7.5% per 100,000 of the population. Currently, we are sitting with a pandemic, if I can call that. There are only 3 higher learning institutions who offer postgraduate diplomas in psychiatric nurses and very few colleges of nursing that offer that. Clearly, it shows that we are lagging behind in achieving mental health for our communities. This, for me, is a great concern. This indicates also, never to be underestimated, this indicates also that this 7.5% of people, of psychiatric nurses, are faced with burden of caring for people living with mental health conditions. Burden of care results in burnout and compassion fatigue for nurses, not only for psychiatric nurses, but all nurses. I co-authored a paper with academics in midwifery and research on compassion fatigue in nurses, a meta-synthesis, and it highlighted results of nurses saying they're just plain worn out, they're walking on a tightrope, it is unbearable weight on their shoulders, they feel alone in a crowd, and they always have to watch their back to say, who has my back? This paper gathered 367 citations of these papers. As you can see, I have already put up some of the published works of papers on psychiatric nursing and mental health, and there's still more to come. As I progressed through my journey in psychiatric nursing, I had an opportunity to work with students in the U21 network on a pilot project on student mental health in regards to the U21 mental health declaration students, mental health declaration. The students from Glasgow, and they were in psychology, and our students from the Faculty of Health Sciences who were in the nursing group. These students participated in this group, in this project. It was a minor group that we wanted to test to see what do the students feel about mental health? What do they think mental health is all about? What do they think about accessing mental health in their own universities? It was very interesting to say that these students said, some of the students, they didn't know where to access the mental health services. Even now, when we did a small project with the U21 group, we just wanted to find out. And some students said, there's no time to look out for mental health services because they have to study. So for me also now, this has become a phenomenon of concern in higher education. And the one thing that makes me to pound on this phenomenon of concern in psychiatric nursing is what can be done to address student mental health challenges. This has escalated the challenges in student mental health, and the higher education is grappling with providing accessible mental health care services. I must say, at this moment where I'm standing right now, I'm very fortunate. One of my students who's passionate, who's working on student mental health challenges in higher education, and she's presented 2 papers already nationally. In 2022, and I must also say I'm very proud of my university also in that regard, that they look after the students. We need access for the students, and the students need to understand that we are here for them. In 2022, Universities of South Africa published a paper on the gap universities have to fill in regarding student mental health issues, and we're still working on that. There are opportunities to achieve mental health for our communities. The first thing is the Mental Health Act, number 17 of 2002. This act is 22 years old. There have been many developments and events, such as life visiting many tragedy, that have overtaken the act. I think I'm in a lucky position to see that we need to achieve mental health for our communities, because there are many tragedies, and every time you're in these boards or you're in meetings, people will say, we need to prevent this. We need to prevent it. It must not be another life as Temane. We are on tenterhooks around mental health issues. The review of the Act is overdue. The issue of human rights is so alive in clinical practice, that the mental health review boards, and the mental health advocacy group are busy trying to sever the issue of human rights. This needs to be addressed by all stakeholders. This is why the role of the advanced psychiatric nurses needs to be elevated in the Act. I went to check again yesterday to see if there is a name called advanced psychiatric nurses in the Act. There's nothing that stands like that. It's only nurses. We are advanced psychiatric nurses. It needs to be elevated in the Act, like other professionals in psychology and social work. In social work. Caregivers of people living with mental health conditions and the people living with mental health need to be actively involved in decision-making process. The caregivers and the same people who are living with the conditions, they need to be taken care of just like any other person, because they need to know what is happening in their lives, even though they don't understand what is happening. The shortage of psychiatric nurses will continue to be a major healthcare challenge. We are still way behind in addressing this issue, and we'll need to do that. The role of the stakeholders need to act on this by granting permissions for access to training in psychiatric nursing and to promote interest in psychiatric nursing. Interest, remember I said interest. People do not have interest in psychiatric nursing. There are very few of us in psychiatric nursing. Training of nurses in the specialization of psychiatric nurses need to encompass not only specific mental health conditions, but also special mental health conditions for intellectually challenged people and disorders of sex development. I'm saying this because we had an opportunity to work with students in this regard. As is, with new programs for nursing, there will be no nurses who will be caring for intellectually challenged people. We have another pandemic on our hands, and also for disorders of sex development. I'm saying this because I have a keen interest on the intellectually disabled people and the disorders of sex development. In my conclusion, I want to state that by embracing these opportunities, we can achieve mental health for communities and assist in fostering a supportive environment that prioritizes mental health. Together, we can work towards a healthier, more resilient communities. One of my PhD students has a thing to say, and I think everybody uses it. So today I'm doing this talk, and I see on my phone comes up mental health, mental health, mental health. And she likes to say when she's under stress, she'll say, but I need to take care of my mental health because mental health is wealth. Before I conclude and thank you, I just want to say happy Mandela's Day, and I hope you have given your 67 minutes. But I would like also to plead with my boss being here that if you can also give 67 rand to our students. I'm going to do mine after this presentation. I want to thank you. Kia leboga, baya danki, giabonga.
Good evening, or is it late afternoon? Vice Chancellor, ladies and gentlemen, it's my pleasure to respond to Prof. Annie's inaugural reason. I support everything she said. I myself am very passionate about mental health. Most people elderly people, teachers and everybody says, there's no such thing like mental illness. You just say, pull up your socks, go on. It's not as easy as that. No, not at all. So, first, Prof. Annie emphasized the necessary understanding of mental health. Mental health is integral part of the person's health. Without healthy persons, we cannot develop as a nation. And currently, our situation is very challenging. She also addressed challenges and opportunities we have. Challenges, she talked about mental health, caregivers, and the burden of mental illness, and living with mental people who battle with mental illness. Studies have shown that caregivers of people with mental illness really develop chronic illnesses. They are stressed out. They can't cope with it. So there is a need for support. Currently, we have many people looking after family members with mental illness. And of course, the people living with mental illness can tell their stories and develop interest in them if people listen to them and understand these stories of challenges. These people are very disadvantaged. Some of the people sitting here are challenged by mental illness, depression, high anxiety levels, stressed out. There are opportunities also to look at these challenges, and the part of the Mental Health Bill, the Mental Health Act 2002, that could be addressed and in admissions of mentally ill people and addressing their needs is very necessary. And of course, the students are also part of this population who are facing challenging times. They need money, they need places to stay, they need food, and you know it's a tremendous challenge. The importance of advocacy and standing up for human rights of people with difficulties is very necessary. Thank you, Prof. Annie, for bringing this to our attention again. We enjoyed your inaugural speech. Thank you.
Annie? Yeah? Ladies and gentlemen, Professor Annie Temane, a round of I was looking through the room, Professor Temane, and I recognized that we have colleagues who are currently within the faculty and they wanted to come and show you their support. And we have colleagues throughout the university and they wanted to come and show you their support. And then we have colleagues who used to be at the university and have come back this evening and they also wanted to come and support you. And we can't forget your family and your friends who are here to show you their commitment and that they care. All of us are testament that you are appreciated and that you are valued and that it is a privilege and an honor to be part of your event this evening. Can we give Professor Annie Temane another round? Ladies and gentlemen, we have reached the end of the program this evening, but please do join us. To my right, we have some refreshments and we would love to have a conversation and spend more time celebrating Professor Temane. Thank you.